This video presentation demonstrates the technique of valve-sparing aortic root replacement in a patient with aortic root aneurysm and bicuspid aortic valve. It is presented by the Division of Cardiothoracic Surgery at Oregon Health and Science University, Portland, Oregon. Bicuspid aortic valve is one of the most common congenital heart lesions and is present in up to 2% of the general population. There is a strong male predominance. It is the most common cause of both isolated aortic stenosis and regurgitation in adults. There is increasing evidence that it is a genetically transmitted disorder. It is commonly found in association with aneurysms of the aortic root and ascending aorta. The reimplantation technique of valve-sparing aortic root replacement has been developed over the past decade through a series of operations pioneered by Dr. Tyrone David. It has emerged as an alternative to conventional aortic root replacement, and more recently has been extended to patients with genetically triggered thoracic aneurysms, such as patients with Marfan syndrome and bicuspid aortic valves. The patient described here is a 36-year-old male with a history of hypertension and recent CVA who was found to have a bicuspid aortic valve and large ascending and aortic root aneurysm. There was mild aortic insufficiency noted. The patient also suffered from developmental delay and was felt by his caregivers to be a poor candidate for long-term anticoagulation with warfarin. He was referred for prophylactic valve-sparing aortic root replacement. The patient's echocardiogram showed